everyone, this is Gio. He's one of our patients. He's been here for, how long have you been here, Gio?
I've been with Salse Chiropractic for probably about 2 years now.
And why have you been here for 2 years?
Well, first I started off in a car accident. I had a lot of pain, and you treated me, and I feel a lot better. But now I want to keep my wellness up and feel better. And I came in today and to talk to you about some issues I'm having with my wrist, my knee, and my back.
All right, well, why don't we take a look at those and see what we can do for you, okay? Let's start out with your wrist. So what happened to your wrist?
So I currently work in a warehouse, and now I'm doing a lot more intensive labor.
Okay.
And
why don't we start out just kind of checking your wrist and seeing how it's doing, okay? First thing I want to do is just kind of take a look. No redness, there's no swelling. And let's check your range of motion. Go ahead and flex your wrist in and bring it back. Now go to the side and this side. Any discomfort with that?
just a little bit on this side when I went this way.
Okay. So this is your radius. This is your distal radius here. Let me just palpate through here. Is any of the tenderness in there? Not too bad?
A little bit right here.
Okay. Does this hand ever go numb or tingly on you?
Yes.
It does. Okay. Why don't we check you for carpal tunnel? Let's see if you might have that. We have a test that'll tell us if that might be going on. This is called Tinel's test, and all we do is we tap on the median nerve right here. So you're just gonna feel a little tap. And do you feel anything when I do that?
I just feel like something in my fingers.
You feel some tingling?
Mm-hmm.
Okay. So, Gio, that's the beginning sign of carpal tunnel. Mm-hmm. And that's something that we as chiropractors treat.
Right.
So when you come in on your regular adjustments, why don't we just incorporate that in, and we'll start to work with you for early carpal tunnel and see if we can take care of that for you. And what was the other issue you had?
I have an issue with my leg. I do work in a warehouse, and I do walk on cement. And I feel like, a lot of pressure right around here, like right underneath my kneecap, where, after walking for a while, I feel like it's just really, really painful.
How long's that been going on?
Well, now that I'm doing a lot more labor and walking on cement, I'm feeling it, maybe every couple days.
Every couple days, okay. And that's been for what period of time now?
It's probably been about 2 weeks so far.
About 2 weeks, okay. So when we start looking at the knee, the first thing we want to look at is just if there's any swelling, any kind of redness. So let's just kind of compare the knees first. So why don't you bring it both up and let's just take a look. So we're looking around the patella and looking for any kind of edema, any redness. And then the next thing we want to check is your range of motion. So take this knee and I want you to just bring it up as high as you can like this. Okay, now go ahead and straighten your leg out as far as you can. Any discomfort with that?
No.
Okay, now I'm just gonna go ahead and pull up here on your leg. And then I'm gonna just drop it. Now, relax your knee, and you're just gonna let the leg just drop down like that, okay? So here we go. This is called bounce home, and it's just testing us for the joint there. No pain with that?
No.
Okay, the last thing is we're gonna check you for some arthritis behind the kneecap. So what I want you to do is I want you to go ahead and flex your quad when I put some pressure right there. So go ahead and flex it. No pain with that?
No.
Okay, great. So that's a good sign. The next thing we want to do is we want to check your foundation, which is your feet. Straight ahead, shoulder width apart. There you go. All right, turn around for me. Okay. Now, why don't you come on over here, and I want you to stand on these scales for 1 foot on each scale. We're just gonna check your balance and see how you're doing here. Look straight ahead, take some deep breaths, and just think balance, and just relax. Okay, come on down. Okay, your balance is really good. We wanna see this within 5 pounds, you're only 1 pound off. Okay, come on over here. And have a seat. Let's check your shoes. And we're just looking for a wear pattern. How long have you had these shoes?
Like 2 days.
Okay, so we're not really gonna see a big wear pattern on that. But typically what we're looking for is a heel strike in this area here on both sides and that it's even. Mm-hmm. And then where you toe off, we're looking here. So I want you to look at your shoes at home and see if you see that pattern where there's a wear here and wear here rather than other areas. Now let's take a look here. Are these inserts?
Yes.
Where did you get these?
REI.
Are these the Super Feet?
Yes.
Oh, it's a different style. I like these. Okay, great. Yeah, I'm glad you have these because you have low arches, and this will really help to stabilize the knee as well. Okay, so very good. All right, so let's go ahead and do a knee adjustment on you and see if that helps. All you're gonna feel is you're just gonna feel a pull here. And we're just gonna release the ankle, the knee, and the hip joint. So here we go. Okay, did you feel that?
Yeah, I definitely felt it in my ankle.
Okay, so now let's go ahead and adjust your knee. You're just gonna come up. Can you handle that much pressure right there?
Yes.
Okay, so all it's gonna be is a quick little push right here. So here we go. Okay. All right, and then let's go ahead and do the other side as well, just to keep it balanced. So here we go. Okay, great.
It feels great on my ankles.
Okay, fantastic. Come on up. And what was the other thing that was bothering you?
I did have pain in my ankles, but it feels like it doesn't hurt anymore. But my upper shoulders right here.
All right, Joe. So this is your scapula right here. And there's a muscle here called the levator scapula. It actually inserts here to the spine of the scapula, and it runs up into your neck. And many times this will tighten up due to our posture. If our head's forward, these muscles will have to work harder. So what happens is you build up a lot of tension and you build up some trigger points in this area. So what we're gonna do is we're gonna go ahead and we're gonna release that tension, and then we're gonna get you adjusted right through here. How's that sound?
That sounds great.
Okay, so let's get started on that. And this is just gonna help with the trigger point and release the soft tissues in this area. How does that feel?
Feels great.
Okay, so this is increasing the circulation to this area. And I just want you to bring your head down this way. All right, there you go.
Yeah, I feel a little tightness on my neck right here.
Right in there. Okay, so we're just gonna run up the levator scapula here. Just take some tension off of there. All right, very good. All right, so I'm feeling a lot of tightness right here. You feel that?
Yes.
Okay, so we're gonna get that adjusted. This is gonna help release the nerves in this area here. A lot of our patients that have asthma, breathing trouble, this actually helps them breathe better. So we're gonna take care of that for you. Take a deep breath in and breathe out all the way. I'm just gonna feel a push right through here. Okay, great. Let's go ahead and take care of your low back, and we'll get this adjusted here. Right there. Okay, take a deep breath in. Breathe out. Just kind of roll down. There you go. Okay, great. Let's go ahead and get to work on you. Let your head just melt into my hand. There it is, right there. Great adjustment. How do you feel?
Feel great. I feel a lot looser in my neck. My knees and ankles, everything's feeling better. Feel great.
Okay, well thanks for coming in today. Good to see you again. All right, we'll see you.